My Hospital Buddy, here to guide you from where you are to where you heal. Meet Alice, an 18-year-old high school student. One day, she gets a call from her mother. She is being rushed to the hospital. She runs there, heart pounding, lost in the maze of hallways and paperwork. Alice's panic is not unique. Many people face these stresses when visiting hospitals. So instead of waiting for a solution, our team chose to create one.
Hi, my name is Aroma and I'm 17 years old.
Hi, my name is Isra and I'm 15 years old.
Hi, my name is Sarah. I'm also 15.
I'm Celine, an upcoming 9th grader.
Hi, my name is Christine and I'm 15 years old.
My name is Maya and I'm 8 years old. Sing My Hospital Buddy, an app which guides patients through the hospital experience, helps patients and visitors find hospital departments quickly and efficiently, reduces stress and waiting times. By implementing SDGs, SDGs 3 and
So how does our app connect to SDGs 3 and 11? It connects to SDG 3, good health and well-being, because by making the hospital experience easier, patients and staff will patients arrive on time, they reduce their own stress and they can focus on being cared for instead of panicking. It also connects to goal 11, sustainable cities and communities, because hospitals are key public spaces. So by making them more accessible, it improves inclusivity, reduces congestion, and creates a more people-friendly environment. Now let's take a look at the numbers that highlight why a solution like ours is urgently needed. 25% of hospital staff get lost moving between departments within their own campuses. 55.8% of recently hospitalized Ontarians said that they did not receive enough information about what to do after leaving the hospital, and 80% of regular patients ask for their way around every single visit. Now, these challenges don't just frustrate patients, but they can drain valuable staff resources and disrupt care, proving the urgent need for a solution like My Hospital Buddy.
Here's a quick overview of all the features we have in our app. So we have a map that lets you search departments and get directions of in anywhere you want in the hospital, a step-by-step guide that informs you throughout your hospital experience, and virtual shareable cards for you and your family. Great for keeping track of allergies, medical info, and emergencies. So now that you've seen a sneak peek of our features, let's take a live and private tour of the app we created with TK.
This is our demo of My Hospital Buddy, and this is our homepage. So basically, preparing for a visit, it leads you to terminology. So sometimes we don't know, like we're preparing for a visit, we don't know what means what, and we're all confused. So here we can click and it gives us a simple definition of each term. And here there's a map of the hospital that you could use. Our app is currently still under construction. We're still working on updating it. So this is kind of like a small little demo. And these are medical notes. So here you can write different notes for like doctors or nurses, or the doctors and nurses can write it for you. So I could just write requires medicine in the morning, like that. And then I could also clear it in case I made a mistake or something. And staying at a hospital. So here, sometimes, people have procedures and you don't understand what they are. Here, they give you a very simple definition on what they are.
Yep. And need tips from others is supposed to be for in case you need any tips from people, you could go and reach out to them. And it also includes tips from us.
And to be completely translucent with you guys, we faced a lot of technical difficulties last night during the hackathon as well as this morning. That's why our app doesn't have all the features that we have talked about, like the translation. We did code it, and we can show you the code that we'll do in a bit. But that's why our app just looks really simple and basic right now.
See, like this is all the code that we did right here, all the pages.
So home.py, I programmed this one. It's supposed to be where you can access all your stuff.
This one is the homepage that we previously showed, I believe. And then this one is the homepage. There was supposed to be a homepage for where you could access both procedures and terminology. So this is that. This is where you get the procedures, the terminology, and this was the map where we saw the photo of the map. And then this is the medical notes tab where we could type in our own information. And these are
So
info cards. I believe they didn't show up, but these are like where you can insert info cards for your family members or your loved ones and just have like information inputted. Like here you can see their phone number, their allergies, their blood type. So that's where you can access it. And then here's preparing for the visit, what to have, what not to have. This is supposed to be like a little checklist on what is necessary for when you go to the hospital. And this is a little settings page where helps with accessibility. So you can access different languages, different fonts, different text sizes, and it makes our app more accessible for people who struggle with like normal day-to-day functions.
For starting off, we chose 6 languages: English, French, Spanish, Urdu, Arabic, and Hindi. Well, we had a really cool perk where after you would save your settings, it would tell you that your settings have been saved in the language that you picked. It would have been really cool for you guys to see that, but since because there were technical difficulties, it won't pop up.
See, this is the code
Um,
for that.
yeah, we also prepared a page for a login. It's not currently in here, but you were able to enter a username and a password. But yeah, it would have been cool to show that. But yeah.
And now let's move back into the slides.
So while making this app, we came across some challenges. The first challenge was navigation. Because navigation is complex, instead of mapping every hospital right away, we'll start with Trillium. And once it's perfected, we'll expand step by step to other hospitals. Our second challenge was income. So running the app will eventually cost money. And we don't want to use a premium paywall since our goal is accessibility. Instead, we plan to partner with Trillium Hospital and bring in volunteers through Instagram and posters. Our third challenge is accessibility, making the app more user-friendly and inclusive. To address this, we'll add features like large text and easy-to-tap elements for smoother navigation. So, sponsorship steps. Step 1, research and target. We chose Trillium Hospital in Mississauga, which is popular and accessible for our target audience. Step 2, proposition. We'd entice them with something they could get out of sponsoring our app, which saves staff time by helping patients navigate. This is especially important during Canada's healthcare staff shortage. Network will reach decision makers through LinkedIn, mutual contacts, and local events. Step 4, proposal. We'll build and maintain the app and they'll provide funding. And together, we'll improve the hospital efficiency and patient experience.
Our target audience is young adults, newcomers to Canada, and the elderly, groups who often struggle most with hospital navigation. But My Hospital Buddy is accessible for anyone in need of assistance. Many hospital experiences consist of chaos, confusing terms, overwhelming procedures, busy staff, and hard to navigate departments. My Hospital Buddy prevents that and creates a stress-free, relaxing hospital experience by providing simple definitions of medical terms and diagnoses, reducing staff stress by helping patients independently, and offering navigation tools to guide users anywhere in the hospital.
Marketing. Our marketing strategies include Instagram page to reach young adults and recruit volunteers, regular posts to keep audiences engaged, posters in popular city areas and hospital waiting rooms, established as a nonprofit organization to build trust, and partnering with local healthcare providers for credibility and awareness. This is an image of our Instagram page that we created where we would post updates and more. And on the left is a flyer that is basically what the app is about and encouraging people to download it. And on the right is a call to fundraising and donations to support the project.
So our first step is to register MHB as a nonprofit organization. So this is going to help us attract more users and also build more trust with their community. Next, we're going to plan partnerships with hospitals, healthcare professionals, and other nonprofit organizations, which I'll get into on the next slide. We also plan to apply for healthcare tech funding so that we can fund our app and make sure we can maintain it. and also try to get community sponsorships to support development. We're also going to run a pilot program, which will launch a test version at one hospital. We're going to gather feedback and then we'll improve before we scale. Finally, we'll hire a freelancer or agency to translate for languages in our app so it appeals to newcomers more. To strengthen our impact, we're collaborating with other NPOs. Here we can see 3. Doctor Interested, Music for Every Child, and Uplifted. We have already reached out to them and we're looking for potential partnerships in the future.
The end. But wait, do you remember Alice, the one lost in the hospital maze, stressed and confused? She didn't stay lost for long. She opened her phone, a glowing path appeared, guiding her step by step past the confusion straight to her mother's room. That buddy is my hospital buddy, here to guide you from where you are to where you heal. Thank you. Any questions?